All right. Hi, everyone. Happy Monday. Welcome to our live stream. Thank you for joining us. My name is Lannia Small, and I lead global strategic partnerships for our social impact team. This means that I work with our clients, nonprofits, governments, and other stakeholders to advance Indeed's mission of helping 1 million job seekers get hired through our social impact initiatives. So that brings us to our next topic, the tip of the week. Understand that practices may have changed in your workplace, but don't be afraid to self-advocate. So what can you expect concretely? First of all, some of employers may offer semi-permanent work from home options. The CDC recommends that non-essential service employers offer remote work when available. Over the last few months, many businesses have realized that these roles can be successfully performed virtually. However, for companies that are reopening their offices, the CDC recommends employers conduct private daily health screens before employees come to the workplace or upon arrival at the workplace. These health screens may check for symptoms of COVID-19 like high fever. The screening process might include checking your temperature, making sure that you're not experiencing coughing, shortness of breath. Just a heads up that if the screening is conducted in person, the screening staff may not have to wear personal protective equipment or PPE if they're able to maintain a distance of 6 feet. Next, you might find that your employer is asking you to take sick leave even more seriously than normal. The CDC recommends that employees who show symptoms of COVID-19 notify their employer, stay home, and do not return to work until it's safe to discontinue home isolation. If you become aware that you were exposed to somebody who has been diagnosed with COVID-19, the CDC recommends that you notify your employer immediately, even if you're not showing symptoms. Also, you can expect to be encouraged to frequently wash your hands or wear cloth face coverings. It might be helpful to know that cloth face coverings are not considered PPE. So if you're wearing a mask, it might prevent you from spreading the virus to others by reducing the spread of respiratory droplets when you're talking or when you sneeze, but it will not protect you from exposure to the virus. Examples of PPE include respirators, medical face masks, and face shields. You might also notice a change in how your employers ask you to work with others. So extra care may be taken to keep workers and customers at a safe distance or physically separated. You might see limited or closed access to common meeting areas like break rooms, kitchens, or lounge areas. You might also see an increase in visual markers encouraging distance and cleanliness. I think we've all gotten used to seeing those signs that encourage staff to wash their hands before returning work. Well, you can now expect to see decals or tape marks indicating where to stand to remain 6 feet apart. While some of the strategies that the CDC recommends other employers to include are things like offering flexible work hours, like rotating or staggering shifts to limit the number of workers in the building at the same time. Some other solutions are modifying the workspaces to increase physical distance and space between workstations, creating space between staff and customers by offering drive-through service options, adding partitions between customers and employees, or delivering services virtually, either by phone or video. So these are some of the possible changes your employer may make to the workplace and some of the standards that they might have when the offices reopen. However, there are steps that you can take to make sure that when you're back in the workplace, you can supplement your safety as well as the overall safety of the community. For example, you might want to consider practicing routine cleaning of frequently touched objects. Things on your workstation, keyboards, telephones, touchscreens. You could also try to avoid using other people's phones, desks, offices, and work equipment whenever possible. All that said, the process of returning to work is understandably nerve-wracking for some people. If you feel concerned or uncertain about the transition back to the office, know that it's okay to ask questions. considering asking your employer what efforts they're making to ensure safety and health of their team when they come back to the workplace. In particular, you might find it helpful to ask, what happens if someone gets sick at work? Or if I'm exposed to somebody who gets sick while at work? Another suggestion here, don't be afraid to talk or ask about possible alternatives. For example, if you take public transportation to get to work, consider asking your employer if they can offer accommodations to reduce your exposure. So shifting your work hours so that you commute during less busy times, or ensuring that you have the opportunity to wash your hands as soon as you arrive to work. If you're somebody who has an increased risk of a serious illness, consider asking to have responsibilities that minimize your contact with others. If you work in retail, this might be stocking shelves versus working as a cashier. So everybody's circumstances are different and business practices are in flux during this transition. So know that it's perfectly acceptable to ask your employer what alternatives that might make you feel more comfortable. So in summary, your employer, they could implement new business operations such as health screenings, social distancing, requiring facial coverings, and more strict leave policies. That said, you should feel comfortable asking questions to better prepare yourself for your business's circumstances, as well as discussing possible alternatives with your employer. We'd also encourage you to go to the CDC's website to learn more about the official government recommendations for re-entering the workplace. So that is it. That is all for today's live stream. Thank you so much for tuning in. See you soon. Bye.